So today we're going to do a clear and brilliant treatment on this patient who has been very kind and volunteered to be videotaped for this procedure. We're going to be doing the 1927 Permea treatment on her face, which is a great treatment for brightening the skin, addressing hyperpigmentation, and just improving the overall radiance of the skin, improving the skin tone. Actually, her treatment plan is a total of 6 clear and brilliant treatments. One every 2 weeks. We're going to do 3 treatments with the Permea handpiece to brighten the skin and even the skin tone, and then we're going to do 3 treatments with the 1440 handpiece, really to improve skin texture, help with minimize pores, and just address the early signs of aging here on her face. So I've already marked her face, the little compartments that I'm going to be treating in. We're going to do a full face treatment, and my goal is to do 4 passes in each compartment, and then sometimes I will occasionally do an additional 2 to 4 passes in areas of more significant concern. So that's 2 passes, and what you expect to see is some slight erythema, redness of the skin. She had numbing, topical numbing, with a lidocaine tetracaine combination for 20 to 30 minutes prior to the procedure, and so it's a relatively comfortable procedure. You do feel a little bit at the hairlines and around the brow. And at the end of the treatment, what I like to do is put on CE ferulic. The studies have demonstrated a 17 times increased uptake of the CE ferulic after this clear and brilliant treatment, hence the name Permea for this handpiece. And clear and brilliant, the CE ferulic is our gold standard antioxidant by SkinCeuticals. And I actually send the patients home on CE ferulic and have them put 4 to 6 drops every morning after the procedure. For this patient, this is treatment number 2 of 6. This is her second Permea treatment, and as we mentioned before, I'm going to be doing 3 treatments with the Permea handpiece, and then followed by 3 treatments with the 1440 handpiece. It's important to know that the different handpieces address different skin concerns. The Permea handpiece is a more superficial laser wavelength. The 1927 is more superficial, and it's really for pigmentation, so areas of hyperpigmentation and uneven skin tone. And it's also, of course, as we mentioned, great for increasing permeability to topical skin actives like vitamin C. I also like to use the Permea handpiece on my melasma patients. It's a gentle laser treatment, the clear and brilliant is, and so it doesn't create much inflammation, which is exactly what we want in melasma patients. So I will do a series of clear and brilliant treatments on my melasma patients and combine it with topical skincare, including antioxidants, hydroquinone and non-hydroquinone based skin lighteners and brighteners. You can see the patient is very comfortable during the treatment. After the treatment, most patients do have redness, and that redness can last anywhere from 12 to 24 hours. And as the redness resolves, they start noticing a sandpaper appearance to the skin, which is normal. And that sandpaper appearance of the skin can last anywhere from a few days to a week. The nice thing about this laser is you can put makeup on right after the laser treatment and cover up any of the redness. This is one of the gentlest lasers that I offer in my practice. It's by the makers, it's by Solta Medical, and Solta is also the makers of Fraxel, and we have the Fraxel Dual device in our practice as well. I consider Fraxel more of a corrective laser, whereas with the Clear and Brilliant I consider it a prevention and maintenance treatment. And so a lot of my patients come in and they've been taking care of their skin and using a sunscreen every day, using an antioxidant, possibly using a retinoid as well. They're getting their injectable treatments, Botox and fillers, and have had chemical peels in the past. And their skin looks really good and they just want to maintain those results, or they start noticing early signs of aging like some fine lines or some irregular skin tone, and the Clear and Brilliant is great for addressing those minor concerns. So that's why my patients commonly hear me refer to the Clear and Brilliant as the baby Fraxel. Really, they're different devices. The Clear and Brilliant, again, a prevention and maintenance treatment, whereas the Fraxel is a truly corrective laser with a little bit more a decent amount more downtime than the Clear and Brilliant. So now we're done with the treatment. We treated the face, we treated around the eyes, the cheeks, the chin, the upper lip, as well as the nose. And now we have a certain post-care regimen that we like with the Permea treatment. I apply some SkinCeuticals CE Ferulic. I apply about 6 to 10 drops of this across the entire face. Remember, studies have shown that there's a 17 times increase in the uptake of this antioxidant right after treatment. So essentially what the Permea does, and hence the name Permea, is it creates little microchannels on the face, and these microchannels allow for the uptake of topical actives, skin actives, SkinCeuticals being the one that was actually, the CE Ferulic being the one that was actually tested, the one product that was used during the research study. And it actually turns out that this permeability is increased for the first day or so after treatment, and so I'm very particular about patients using the CE Ferulic the next morning after the treatment. And actually, I'm a big believer in antioxidants, and so most of my patients are on antioxidants every morning anyways. And so this is a really important part of the treatment in my eyes. My mind is. So, and then I like to apply another product from SkinCeuticals. It's a very calming product, so it's called a phytocorrective mask, and it's one of the most soothing products that we sell in our office, and that's available through the SkinCeuticals product line. So I apply this to the face, and a lot of times I'll send patients home with this product as well. And it's very hydrating, very soothing, and sometimes what I'll tell patients to do is just apply this either as a mask for 15 minutes at night, a couple of times a week, and then wash it off, or you can even apply it at night for 15 minutes and then rub it into the skin and sleep with it on, and you wake up with really refreshed, hydrated, calm skin. And it's great for helping with the redness right after the laser treatment. And then the last thing that I like to do is all of my patients who come in for a Clear and Brilliant treatment, or actually any laser treatment, resurfacing laser treatment, get this same post-care regimen. We also put a biocellulose treatment mask on. Having a little bit of trouble, as you can see, with this, but I'll get it. And these gloves don't make it easy for doing this. Usually my team has this ready for me, but Shaun is actually the one behind the video camera right now. There we go. Alright, so we're going to apply this mask. This is actually this particular patient's second Clear and Brilliant treatment, and she kind of already, she knows all the steps. She says it feels good. This is very common right after the procedure. So the idea is patients leave here without looking too red because of all of these masks and calming products that we use after the procedure. So we leave this mask on for about 15 minutes. The patient's just calm, relaxes here for 15 minutes with this mask on. Then we apply some physical sunscreen to her skin and send her on her way.
I feel refreshing.
Huh?
You feel refreshing your mask.
You're doing great. All right, keep your eyes closed. And I know you wanted your head up a little bit, so I'm going to put it up a little, okay?
Thank
Are
you.
you more comfortable this way?
Yes.
Tell me when to stop.
Here.
Okay, perfect.
Thank you.
Perfect. 15 minutes. You'll time, Shaun, and then just put physical sunscreen on, okay?